Hey guys, it's Dr. Greg Judice with Judice Sports and Rehab. Like we talked about last week, one of the weeks for August is going to be a kind of a different. We're not talking about a body part this week. We're actually talking about direct access to physical therapy. So we're going to talk about what it is, why it's important, what's the beef, or why people have an issue with it, why some people have an issue with it, and then how you can help. So direct access in general is patients' access to physical therapy without a referral. Okay, right now in Missouri, we do not have direct access to physical therapy. So for me to be able to treat a client, I have to have a physician referral to be able to treat that person. So we can evaluate, but we can't treat without that physician referral at the moment. So 44, at least 44, there's kind of different levels of direct access, but 44 out of the 50 states have some form of direct access, and Missouri is not one of them at the moment. And nobody has reversed direct access, so when a state gets it, they like it and they stick with it. And so I'm trying to, drum up some support or create some support for direct access in Missouri, and it's actually up for a vote in the House this year. So hopefully we can make some progress towards that. Wanted to talk to you guys about why it's so important. First of all, selfishly, it's good for business. For me to be able to treat people who want to see me without having any other barriers is a great thing. But unselfishly, there are plenty of good reasons why direct access is a great thing for patients. It's a great thing for taxpayers, and we'll kind of go into that now. So the first is cost containment. So not having to go through a gatekeeper to receive care is a really great thing. And so being able to say, oh, you know what, my back's been bothering me or my hip's been bothering me, I should go see someone that can take care of this. Going to see a physical therapist, a trained, competent professional to help you is a great thing. And not having to go to a physician's office or a chiropractor's office just to get a referral for something that we can handle would definitely help with costs. Second is the speed of care. If you have an issue today, we want you to be able to call us and get in this week. There's a lot of evidence showing that the quicker you're able to start therapy or the quicker you're able to begin care, the more beneficial care is going to be. So there's a wide variety of conditions that we can treat, of course, but actually one of the biggest things that we treat is low back pain. And the evidence shows that one of the types of treatments that we would use is best if done within 16 days of the beginning of back pain. So I know that seems kind of like a random number, but that's what the evidence shows on that. And so if you were able to get into physical therapy within 16 days, the effectiveness of that treatment is way increased. But what happens in Missouri right now, you may not deal with it for a few days, just hoping that it would go away, but after a week, it's time to deal with it. It's time to get seen. The issue with that is right now you would have to either go to urgent care or call your primary physician to get an appointment and then try to get an appointment with PT. And that's just a ton of time taken away from the care that you could receive seeing a physical therapist directly. Next, why is it important? Why is it good? Better access to quality care. There's just fewer steps. So back to that speed of care, you're not having to deal with being at the mercy of who you can see when. You can call whoever you would like to see and have a much greater choice in who you're going to be seen by. So if you find the right therapist for you, if you find the right type of care for you, you should be able to go see that person right away. And in the bigger hospital systems, there are some pay-for-referral type of situations that do happen. So I'm going to just say Hospital A. If Hospital A has a physician that is going to refer to a physical therapist. Typically, they're going to refer to the therapists that work for Hospital A as well. And that is a big ethical issue, because they should let the client choose or refer to the best therapist, or who can take the best care of them. Also, another good thing about direct access, there's a significant shorter duration of care. 123%. I know I don't like to throw around numbers too much, but 123% less time spent with a therapist when it's a direct access patient versus when it is a referral from a physician. And then the biggest one for me is fewer medications or surgeries. That's my tagline. That's part of my entire job, is to help people get back to their lives without medications or surgery. And so these are a lot of the things that are not able to be done in Missouri because we do not have that direct access. So those all sound like great things. And so your next question is probably, what's the beef? Why are certain people not in support of direct access? So the biggest, antagonists, that's not the greatest word there, but the biggest opponents, let's go with that. The biggest opponents to direct access are the physicians and chiropractors in Missouri. They never work together except when they're working against us, which is right now. Their biggest thing are with diagnosis limitations. So they're saying that we can't diagnose certain conditions, and that's true, but we don't need to diagnose certain conditions. So if someone comes into the clinic, we're able to, hey Deanna, we're able to evaluate them and say whether or not they're appropriate for physical therapy. And so that's the biggest thing. We don't have to be able to diagnose specifically, but the big point is to be able to make sure that we're able to identify the red flags and help them find the right person for them if they're not appropriate for physical therapy. They also say that we're not qualified, which is kind of funny because we have significant more training than they do in the area of orthopedics. General practitioner physician spends less than 3 weeks on musculoskeletal conditions, and we spend close to 3 years on it. So that I totally discount that one, and it's just something that they say but they can't possibly really believe. The biggest one that they say is something against direct access is safety concerns. As I said at the very beginning, 44 out of the 50 states have direct access, and there has been zero increase in litigation against physical therapists since that has begun. So the safety concerns are not there. The diagnosis limitations are not there. The qualifications limitations are not there. And so there's just no reason not to go the direct access route. My belief is it's more of a financial concern for them, kind of in that greed mentality or that lack mentality. And so there are plenty of people to be seen. But limiting care is not the best way to provide high quality care. So hopefully, if you were not on board with direct access, you are now. But how you can help. I'm going to post a couple of articles, maybe like a one-page summary of some supporting articles for direct access underneath this video. And then the biggest thing that you can do to support us as physical therapists in Missouri is to support House Bill 2090. I can send you a canned letter that you can send to your representative. If you will comment below, just say that you're interested in helping with, just put HB 2090, and I'll send you a letter that you can send to your representative. All you have to do is sign it and send it. If you would be willing to do that, that would be amazing. Great help. The congressmen in Missouri really do appreciate the letters, and I really would appreciate some help getting this passed. And I can't do it alone, and there are a lot of physical therapists that would appreciate that direct access. So I think that's all I've got for today. I'll be back on next week, next Friday, and we will be talking about the shoulder. we'll do Q&A. So if you want to post some questions about the shoulder under this video, or we'll make a post early next week. But yeah, would love to talk about the shoulder next week. But again, comment below HB2090 if you're willing to help us get some direct access here in Missouri. Thanks, guys.